How do doctors use court and ultrasound to check for hematuria? When blood appears in the urine, it can be a sign of various health issues, especially involving the urinary tract. To find out what's causing hematuria, doctors relying on imaging tests like ultrasound and computed tomography scans. These tools help visualize the kidneys, bladder, and other parts of the urinary system to identify any abnormalities or potential sources of bleeding. Ultrasound is often the first step because it is safe, non-invasive, and does not involve radiation. It uses high-frequency sound waves to create images of the kidneys and bladder. Ultrasound can detect stones, cysts, or masses that might be causing bleeding. It's especially useful for patients with microscopic hematuria, where blood is only visible under a microscope, and for those who cannot have contrast dye or radiation due to allergies or other health concerns. If ultrasound results are normal but the patient has risk factors like being over 50 or having a history of smoking, or if the blood in the urine is visible and persistent, a more detailed scan, called a court urography, is often recommended. This specialized court scan involves injecting contrast dye into a vein, which helps highlight the urinary tract during different phases of the scan. It produces high-resolution images that can reveal small tumors, stones, or structural issues that might be missed with ultrasound. Court urography is considered the most sensitive and specific imaging test for detecting urothelial cancers, which are cancers of the lining of the kidneys, ureters, and bladder. It can detect tiny lesions with a high degree of accuracy, with sensitivity around 96% and specificity close to 99%. Because it involves radiation and contrast dye, doctors weigh the benefits against potential risks, especially in patients with kidney problems or allergies to contrast. The decision on whether to start with ultrasound or go directly to court urography depends on the patient's age, risk factors, and the type of hematuria. For low-risk patients with microscopic blood, ultrasound is usually enough to begin with. For those with visible blood or higher risk factors, court urography provides a more comprehensive evaluation. Sometimes, if ultrasound shows abnormalities, a court scan is ordered to get more detailed information. It's important to remember that imaging is just one part of the overall assessment. Doctors also perform cystoscopy, which involves inserting a thin tube with a camera into the bladder to look directly at the lining. Urine tests like cytology can also help identify abnormal cells. Combining these methods helps ensure a thorough investigation to catch conditions like bladder cancer early. In summary, ultrasound serves as a safe initial screening tool for many patients with hematuria, especially those at lower risk. When more detailed information is needed, or if initial tests suggest something abnormal, court urography provides a highly accurate way to detect tumors, stones, or other issues in the urinary tract. Always consult a healthcare professional for personalized advice and appropriate testing based on individual health history and risk factors.